Hello, and a very warm welcome to the Cow's Milk Allergy Clinic. My name is Caroline Smith, lead paediatric dietitian for the Cow's Milk Allergy Service in the South Eastern Trust. This is our group education session, and we are sending you this talk so that you have time to listen and absorb a lot of information before we then meet with you on a one-to-one basis via Zoom to hear a little bit more about your own story and provide an individual assessment and advice for your baby. In this session, we will be covering what is milk allergy, how it is diagnosed, and how we manage it, including milk-free weaning. Let's talk about what is milk allergy first. Milk allergy is not an intolerance. Please don't let anybody say to you that your baby has a milk intolerance. They are two different things. Milk intolerance, or what's more commonly known as lactose intolerance, is the inability to digest milk sugar, which is called lactose, and this is exceptionally rare in babies. Breast milk and formula milk contain lactose, and the vast majority of babies have no issue with digesting it. The problem with these little ones is that they struggle to digest the milk protein, and that is because their immune system is having an allergic response to the protein. An allergy is always an immune system overreaction to the presence of a protein, in this case, cow's milk protein. When the baby's body detects the milk protein, the immune system overreacts, and that's what causes the symptoms. And this is why we know this condition as cow's milk protein allergy. Cow's milk protein allergy is the most common food allergy in infants. This stat of around 2% comes from the British Society of Allergy and Clinical Immunology guidance from 2013. So we know now that this number is probably a lot lower than the stats we're seeing at the moment. Within the South Eastern Trust, over 10% of babies are referred to this clinic with suspected or confirmed cow's milk protein allergy. We know that if you yourself have an allergic or atopic condition such as eczema, asthma, hay fever, or a food allergy, that your baby was more likely to develop a cow's milk allergy. We're interested in family history of a parent or a sibling, and we'll be keen to hear about that when we speak to you in your one-to-one. How do we get a diagnosis of milk allergy? Usually it starts with a little bit of symptom spotting. So usually a parent or a health visitor or a GP will start to recognize a consistent pattern of symptoms. With this type of milk allergy that we focus on in this clinic, the symptoms are delayed, and this can make it hard to spot. Many of these symptoms are also completely normal for small newborn babies. So what we need to see is that the symptoms are severe and persistent. They don't get better with time. The symptoms in the delayed or non-IgE type of allergy tend to be present within the gut and the skin. They are gradual in their onset, appearing 2 to 72 hours after exposure to cow's milk protein. But since you're feeding your baby all the time, the symptoms will be present all the time. Let's have a look at what we might see in a baby who has a cow's milk protein allergy. Gut symptoms are by far one of the most common. We will frequently see babies with severe persistent diarrhea, loose watery nappies, explosive nappies, going down their legs and up their back. Some parents describe to me poos like pure water that soak into the nappy. And frequently these are regular through the day, maybe multiple times a day, often after every feed. Some babies get the opposite and they become quite constipated. They're grunting and pushing and straining, and they're really struggling to pass a poo. When they do eventually squeeze the poo out, it's often really large and soft, sometimes really smelly and full of mucus. And you're wondering why on earth it took them so long to pass something that was so soft. But the constipation is often a sign of poor gut motility. So what that means is that babies' muscles are struggling to move in a nice, smooth way to push out the poo. So they grunt and push and strain. The poo isn't hard, it's not difficult to pass, it's just that their muscles aren't moving very smoothly. Some babies present with lots of mucus in their poos, and that can be a little bit worrying and make you wonder what on earth is going on. But mucus is just a sign of gut inflammation and irritation. You'll see blobs of mucus, stringy mucus, shiny mucus, and that's a sign that something's going on within baby's gut. Some babies present with fresh blood in the poo, and if that happens, it needs to be checked out by a doctor, either your own GP or maybe up at our short stay unit, just to make sure there's no other reason why your baby might have blood in their stools. Some babies develop really painful bloating and wind. You might be surprised at how noisy and how smelly the wind is that your little one can produce. Some babies get very painful trapped wind. They struggle to pass their wind and they're in a lot of pain. Their tummies are sore and bloated. The other thing that causes a lot of pain with these little ones is reflux, and reflux can be a common symptom of milk allergy. It's important to note that milk allergy does not cause reflux, but it can be a significant trigger in some, but not all babies. Babies with reflux will cry for prolonged periods of time, a very high-pitched, painful cry. They'll arch their backs, stretch out their legs, and they don't like to be laid down flat. You may be finding yourself pacing the floor up and down, holding your baby, rocking your baby, helping to settle them. And then soon after you settle them, they wake up again crying because of the pain of the reflux. Some babies with reflux will vomit and posit, but they won't all vomit or posit. Sometimes you can see or you can smell acid reflux coming up and down in their throat, but they're not necessarily bringing up large volumes of milk or secretions. They're just, you can see the outside signs of the reflux, but not necessarily vomiting or positing. Whereas other babies will vomit and posit a lot with reflux, and you'll be going through multiple changes of clothes and lots of wet muslins in a day. The other area that's really affected by cow's milk allergy can be the skin. Some babies with cow's milk allergy will present to us with significant skin symptoms, dry patches on their skin, skin that goes red and inflamed, a rash that looks kind of like a heat rash, little red speckles or pinpricks over the face and down the body. And some babies with milk allergy develop infantile eczema, where the skin is red, inflamed and broken and may be weeping or bleeding. Another reminder that eczema is not caused by milk allergy. Milk allergy can trigger eczema, but eczema is a primary condition. Your baby develops eczema and milk allergy may be a trigger. It may be the only trigger, and treating the milk allergy may resolve the skin, but it may not be the only trigger, and your baby may continue to have persistent eczema that needs treated beyond their milk allergy. ARIES used to be a criteria that we used to diagnose milk allergy, but it's not anymore. Nowadays, lots of babies experience congestion snuffles, and if we diagnosed all of them with a milk allergy, we might find that we were getting a lot more referrals to this clinic. It's interesting in hindsight to hear if your baby's congestion or snuffles improved whenever we treated their milk allergy, but we don't use it as a diagnostic criteria anymore. We're interested in gut and skin symptoms that are severe and persistent and that are improving when we treat a milk allergy, and that will help us with our diagnosis. To get a diagnosis of a delayed milk allergy, you need to go dairy-free if you yourself are breastfeeding, or if your baby is formula fed, you'll be prescribed a prescription formula for a period of up to 4 weeks. We can't do any tests to diagnose this type of allergy, and I'll explain why in a few slides' time. The only way we can diagnose this type of allergy is to do a process called exclusion, where we exclude for up to 4 weeks, and then we reintroduce cow's milk protein back into baby's diet using a process called the milk challenge. For our formula-fed babies, this process involves introducing 1 scoop of a standard formula back into their bottle of their prescription formula. Every day, we should increase by 1 scoop of standard formula and reduce by 1 scoop of prescription formula until your baby can manage a full bottle of standard formula. Then you can switch over the other bottles in turn if symptoms have not reappeared. If your baby is breastfed, then you yourself should start introducing cow's milk protein containing foods into your diet over a period of around a week or so. You might try some baked milk in the form of a pancake or a biscuit, moving on to cheese, chocolate, ice cream, custard, and eventually cow's milk. Do this slowly over a period of a week, watching for symptoms within your baby. If symptoms appear on either of these challenge processes, stop the challenge. We've confirmed your baby has cow's milk allergy and they should return to a dairy-free diet. If you scan the QR code in the morning, there's a more comprehensive leaflet on doing the milk challenge. The milk challenge is an extremely important process. It's the only way that we have to confirm a diagnosis of cow's milk protein allergy. We don't want to be restricting you or your baby unnecessarily, so it's really important to milk challenge. We know that babies are being diagnosed early on in life, in those early weeks when their tummies are very immature. So sometimes they outgrow their milk allergy quite quickly, or sometimes they didn't have milk allergy in the first place. They just needed a little bit of time for their tummies to settle and mature. There's information about this within the booklet that you'll have been sent, and we can talk to you about it in your one-to-one if you haven't already carried out the process. I want to talk for a little minute around a different type of allergy. This type of allergy is maybe more well known. This is the fast or immediate onset allergy, and maybe this is what you thought allergies presented like before you had a baby with suspected cow's milk allergy. These symptoms occur very quickly, usually within minutes while you're still eating the thing that you're allergic to. But the window of opportunity is up to 2 hours, so you do need to be mindful of any symptoms that appear within 2 hours of exposure to the thing that you are allergic to. So, signs of a fast allergy. Initially, you might see reddening or flushing of the skin during or after a feed. A very specific type of rash called urticaria can develop. This looks like a nettle sting. We commonly term this rash hives. You'll see big white lumps appear over the face, perhaps down the neck and onto the body. It's a very distinctive rash. Some babies will develop facial swelling or puffiness, particularly around their eyes and lips. If they develop swelling within the mouth, they can have restricted breathing. You might notice that they're coughing, their breathing becomes more laboured, they start wheezing, they look pale, lethargic and tired, or their lips go blue. This is a medical emergency and you need to contact 999 or attend A&E if any of those symptoms appear. This is, however, extremely rare. Some babies with a fast type allergy develop symptoms like hay fever, basically, where their eyes water, their nose runs, and they sneeze. And some babies, when they're allergic to a certain food, vomit really severely. This isn't like vomiting, this is a really severe rejection of the thing that they've just eaten. It's a very dramatic vomit, and it's often full of mucus, and it's really smelly and unpleasant. If any of those symptoms ring a bell, I wouldn't be challenging you. A reminder to seek urgent medical advice if you're worried about your baby. But the treatment is the same if we suspect this type of allergy. Breastfeeding mums, you should go dairy-free, and formula-fed babies, you should be transferred onto a specific specialist formula. At this point, we can refer you to allergy services, where our doctors might consider doing one of 2 types of tests, or even both types of tests. And this testing can involve a skin prick test or a blood test. Why can we test for this type of allergy but not the delayed allergy? It's all to do with this little word IgE. So IgE stands for immunoglobulin E. Immunoglobulin E is an immune system molecule made by your body, and immunoglobulin E molecules can be made to attack any type of allergen, and we can measure them within the body if you have a fast allergic reaction. So you can measure IgE levels to milk with a skin prick test or a blood test, but only if the history suggests that a fast allergy has taken place. Remember, on the delayed allergy, it was known as a non-IgE allergy. Non-IgE allergies or delayed type allergies will not show up on an allergy test because there's no IgE molecules present within your baby's body. The only way to diagnose those allergies is exclusion and reintroduction. A reminder to our breastfed babies. Sometimes breastfed babies react through their mum's milk, but sometimes they don't. Sometimes they only react when they're given a top-up of a standard formula or when they start weaning and they're given something containing milk protein within their diet. If that's the case, mum doesn't need to exclude dairy from her diet. However, if baby is reacting through mum's breast milk, then they do need to exclude dairy from their own diet, and they need to ensure that they're getting enough calcium and vitamin D, and in all likelihood take a supplement. And I'll talk about this a little bit more later. If you're formula feeding, your baby will have been prescribed one of 2 groups of formulas. The first group, and what we tend to use as our first line treatment, are called the extensively hydrolyzed formulas, or EHFs. And these include Nutramigen 1, Pepti 1, and Althera. These are really well tolerated by the vast majority of babies, and they tend to resolve the symptoms in babies who have a suspected cow's milk allergy most of the time. I know to our adult palate they taste and smell not great, but most of our babies do very well on these formulas. It sometimes takes a few days, even a couple of weeks, to establish these formulas, but once babies are feeling better and they get used to the taste and the smell, they tend to take them without a problem. We do have a small group of babies who need the next group of formulas. So it may be that a baby doesn't settle well on the extensively hydrolyzed formula. They might have a few days where things are going well, symptoms are resolving, and you think you've cracked it, but then the symptoms creep back in again. And it may be that we need to scale them up to the next group of formulas called the amino acid formulas. We also have a group of babies who present to us with significant severe symptoms in the first place. So you might find babies who have blood in the stools, severe reflux, severe infantile eczema that's not responding to typical treatments, or babies with really bad faltering growth, very bottle aversive, having a really difficult time with feeding. We may jump directly to an amino acid formula for these babies. So what's the difference in these two formulas? It's all to do with the protein breakdown. In a cow's milk protein, you'll see in this first picture that it's a big long chain. Cow's milk protein kind of looks like a big long necklace of beads. If you take that big long chain and chop it up, you get all these little smaller chains called peptides. Peptides are what you'll find in comfort formulas, but comfort formulas won't tend to do the trick for treating cow's milk protein allergy. You need a next stage, and that's where the extensively hydrolyzed formulas come in. You'll see here that the protein chain has been predominantly broken down into single molecules, or sometimes molecules of 2 or 3 joined together. This is what Nutramigen or Pepti will look like. If, however, we need to go to the last stage, formulas like Neocate, Alpha Amino, and Pure Amino, every single molecule here within the chain exists on its own. The molecules are called amino acids. At this point, we have treated your baby's milk allergy as far as we can. And if your baby has persistent eczema or reflux, then we need to optimize management of these with your doctor. Let's talk about milk-free weaning. If your baby's diagnosed with a cow's milk allergy, they need to remain dairy-free for a minimum of 6 months and until they are at least 9 months of age. So they're going to start their weaning journey dairy-free. Weaning a baby with milk allergy is really not so much different from weaning a baby without milk allergy. Weaning should commence at around 6 months of age and not before 17 weeks. Readiness for weaning is all to do with 3 developmental things that your baby needs to be able to do. First of all, they need to be able to hold up their own head. Second of all, they need to be able to sit with minimal support. I don't expect your baby to sit by themselves, but they should be confident sitting with minimal support in their high chair, in a bumbo with appropriate support around their waist so that there's a straight line between their nose and their belly button. This minimizes any risk of choking. The other thing your baby needs to be able to do is swallow safely. And in order to do that, they need to push their tongue to the back of their mouth and push the food down their throat. If your baby has their tongue reflex, then they're not quite ready to start weaning. The tongue reflex is where your baby will be sticking their tongue out of their mouth, pushing the tongue out of the mouth. And it isn't much help when it comes to swallowing. It's great when it comes to sucking, but your baby needs to be able to push their tongue to the back of their mouth to swallow. So if they're poking their tongue out of their mouth a lot, and if they push food out of their mouth when you try to feed them, then you need to wait a little bit longer until they stop doing that quite so much. You'll also notice your baby becomes really interested in the food around them, watching you eat, really interested in what you're eating. These are all good signs that your baby's ready to start weaning. As you start weaning, don't worry too much about how much they eat. All babies are completely different. And the most important thing when you start weaning is to respond to your baby. Go at their pace, recognize their hunger and fullness cues. Let them get messy, because the messier they get, the more they're going to learn about the taste and texture of food. They're going to lick and squish and explore. Give them their own spoon to get used to the feel of that in their mouth. Again, don't worry if they're not eating an awful lot. Exploration, having fun, getting messy is a really important way to start weaning. And if they see that you're having fun, then they'll be having fun as well. If you're making a lot of food yourself, remember to check the temperature and know what salt or sugar in anything we make for our babies. If we're starting weaning between 4 and 6 months, I tend to start with lovely tasty food like veggies and fruit. You don't need to spend 3 days on individual fruit or veg. These foods are very low allergenicity. That means they're very unlikely to cause a food allergy. So you can introduce 1 or 2 new foods per day. If you're weaning between 4 and 6 months, your baby will need to start on smooth purees off a spoon. They're not quite ready for finger foods yet. Foods like carrots, parsnips, butternut squash, broccoli, courgette, sweet potato, mashed potato, banana, pear, mango, steamed apple, plums are all brilliant first weaning foods. They're really tasty and they'll blend to a smooth puree. You can blend them with the cooking water, which is full of nutrients, with some boiled water, with some dairy-free butter, or if you're breastfeeding, with some express breast milk. I don't tend to recommend blending your veggies and fruit with your baby's formula because the formulas are such a distinctive taste that they'll overwhelm the taste of the veggies and fruit. And it's a great idea for your baby to get used to these new flavors. You can start to bring in some cereals. Baby rice is a little bit bland on its own, but mixed in with veggies can be a good way to bulk out the veggies. Starting with some ground oats is another fabulous first weaning food. Things like Ready Break or a supermarket own brand hot oat cereal are a lovely smooth consistency, and you can mix it with some water or express breast milk and a little bit of blended fruit or a fruit pouch or pot. As your baby gets a little bit older, you can start to bring in protein-based foods. Beans and lentils are such an easy way to add protein. Boil up a sweet potato or a butternut squash with some red lentils, or add in tins of cannellini beans, broad beans, or lovely sauced haricot beans. I'm not talking about baked beans here that have salt and sugar within the sauce. I'm talking about tinned beans in water, like broad beans, butter beans, haricot beans, and cannellini beans. You can also introduce shredded chicken, mince, turkey mince, little bits of pork mince or beef mince. Stewed beef is another great one to try if you're a family that eats meat. As your baby gets older, we need to think about introducing other allergens. So we know that there's a list of top allergens, and we need to introduce these in a very specific way. Make a note of this. First of all, we're going to start with a small amount. A small amount will always equal a small reaction. Secondly, we're going to do this early on in the day. And thirdly, we're going to observe our babies for 2 hours after exposure. Because remember that 2 hours is the window of opportunity for a fast worrying reaction to occur. I've mentioned briefly introducing gluten. Gluten is the protein found in oats and wheat, and it is a known allergen, but it's very unusual in babies. But the first time you give some oats in the form of Ready Break, porridge oats, or some wheat in the form of Weetabix or pasta, it's a good idea to keep an eye on your baby for a couple of hours afterwards, just to make sure there's no reaction. Fish is always going to be a fast allergy. So introduce your fish one at a time in small amounts. It's exceptionally rare for babies to be allergic to fish, so don't overthink it. Introduce a small amount of flaked cod or flaked salmon to your baby and watch them for 2 hours afterwards. I want to talk about soya for a little moment. Soya tends to go hand in hand with milk allergy in a number of cases, but not always. I don't want you to avoid soya unless you absolutely have to. Yes, there is an increased risk of having a soya allergy if you have a milk allergy, but soya is an extremely useful replacement for dairy, and it's also really tricky to avoid. It's in a lot of food. So if you don't have to avoid it, I wouldn't advise you do avoid it. The best way to introduce a little bit of soya is to give your baby some soya yogurt or some soya milk into their cereal. Symptoms tend to be the same delayed or non-IgE type symptoms as I explained at the beginning with milk allergy, flare-ups of gut and skin symptoms. If your baby doesn't have any reaction, they can include soya products like soya yogurt and soya milk as part of their diet from the age of 6 months. You'll also find soya flour in most breads. So it's a good idea to know if they can tolerate soya, because it is tricky to avoid if they can't. If your baby has a reaction, get in touch and I'll talk to you more about that. I'm going to talk about a couple of other allergens on the next slide. But in time, I'm just going to briefly spend some time talking about introducing finger foods. Some parents are really keen to do this and to take a more baby-led weaning approach to feeding their baby. For some parents, though, it causes a lot of anxiety. They feel that there's a risk in terms of choking. Let me reassure you that babies are designed to eat and to manage finger foods. In smaller babies, bigger is better. And you should check out a website such as First Steps Nutrition for an excellent weaning guide with pictures that can show you how to present food to babies at certain ages and stages. With our babies from 6 months, we can start presenting them with larger portions of finger foods, steamed or roast vegetables, steamed broccoli, banana. That's if you stick your finger down the middle of a banana and break it into segments, that's a great first finger food. Puff crisps like carrot sticks and sweet corn rings and wafers will dissolve in the mouth, and that might help you feel a little bit safer knowing that that food won't remain a solid piece in baby's mouth. Practice is key here. The more opportunity you give your baby to practice with finger foods, the more they'll get the hang of it. If you're really worried about choking, I want to reassure you that it's exceptionally rare and unusual for a genuine choking episode to occur. What happens more often is that your baby will gag. Babies have a high up gag reflex, and this protects their airways. Gagging is actually a safe response. I know it's not very pleasant to watch, and I know it can cause anxiety, but if your baby is coughing and red, let them go ahead. If your baby is silent and blue, then they need help from you. A true choke, the baby can't make a noise. They'll go silent and their lips might go blue. If you don't know what to do, scan the QR code in the corner and that will take you to a video with more information about how to treat a baby who's having a genuine choking episode. But remember, this is really very rare. Gagging and coughing is common and normal, and it'll reduce the more you let your baby practice finger foods. But choking is extremely rare, so don't let a fear of choking hold you back from letting your baby progress with their eating skills. It's really important that they're given the opportunity to practice. If you're spoon feeding, you should be offering mashed food or lumpy food off a spoon from in and around 6 months. If you haven't already by 6 months, introduce a cup or a spouted beaker, and that can contain tap water. I want to mention specifically introduction of egg and nuts. We now know that early introduction of egg and nuts into your baby's diet can significantly reduce a potential allergic reaction. So we would encourage you to feed your baby hard-boiled egg and smooth nut butter from as early on as they start weaning. How are we going to do this? Well, introducing hard-boiled egg is relatively straightforward. Boil an egg for 11 to 15 minutes until it's hard all the way through. Blend it down to a smooth paste using a little bit of boiled water. Then you can take a 1/4 teaspoon of your paste of boiled egg and mash it up with a familiar food, something like sweet potato or mashed potato. You can then feed this directly into your baby's mouth and observe them for 2 hours for any fast reaction. The majority of reactions to egg involve mild facial rashes, hives, and sometimes a mild facial swelling. If that happens, get in touch and we can discuss this further. If your baby tolerates their first taste of egg, try and introduce increasing amounts over a few days until they can manage a full teaspoon. And once they manage a full teaspoon, you should aim to include egg at least twice a week within their diet. Things like fritters, eggy bread, omelette fingers, scrambled egg, and mashed up boiled egg are a lovely, nutritious meal or snack for your baby. Then we're going to consider introducing nuts, and the easiest and most common way to do this is with nut butters. So peanut is probably the most common one that we would come across. Find a tin or a jar of 100% smooth peanut butter. Mix a 1/4 teaspoon of this with some boiled water because peanut butter is claggy and it can be a choking risk. So mix it with a little bit of boiled water and then mash this in with some porridge or fruit. Something like a banana is a great way to add peanut butter into food. Feed this directly into your baby's mouth and observe them for 2 hours afterwards. Again, most reactions involve mild facial redness hives, and sometimes swelling. If you're worried about your baby, then you need to attend A&E or contact the out-of-hours doctor. I've put a little QR code in the corner which links you to the British Society of Allergy and Clinical Immunology guidance on introducing allergens. I've also explained this extensively on page 20 of your book. If you're worried about this, talk to us in your one-to-one. I want to say, for those of you who have babies with eczema is the highest risk factor for developing egg and nut allergies. And that's because allergies begin through the skin. If your skin barrier is broken or inflamed, then it gives a way for that protein, that food protein, to enter through the skin. The barrier is not complete. The skin is broken. The food protein can enter through the skin. The baby's body detects it. It starts to make IgE antibodies against it. And then when your baby eats the food, they can then have an allergic response. So this is why optimizing skincare is really important, and don't introduce egg and nuts until your baby's skin is settled. It's also extremely important that once you introduce egg and nuts, you don't then stop giving them to your baby. Once they're in, they need to stay in their diet at least twice a week. Let's talk quickly about food labeling. All allergens must be listed by law on the food label in bold or italics, so it should be easy to see if milk is present as an ingredient in your baby's food. I would remind you to check every label every time. And that's because whenever manufacturers make their products, sometimes they make a change and they don't make that clear on the front of the package. So check every label every time, even if it's something that you buy all the time. If it has milk in bold as an ingredient, it's not okay for your baby with cow's milk allergy. You'll see lots of may contain, or what we call precautionary allergen labels on food. Ready Breck's a good example. There's no milk in Ready Breck according to the ingredients, but it does have a precautionary allergen label on it, as do many packaged foods. If your baby has a delayed non-IgE cow's milk allergy, I'm happy for you to consume foods with precautionary allergen labels on them. These labels are aimed at people with severe, significant, life-threatening food allergies, and they should take heed of these labels. But if you have a delayed allergy, I'm happy for you to consume these foods as part of your baby's diet. There's lots of baby foods out there that may not be marketed as being milk-free, but that don't contain any milk. I've already mentioned these lovely bite and dissolve foods, which are a great way to practice finger foods. Milky sticks, veggie straws, carrot puffs and sweet corn rings, rice cakes and wafers are all a great way to give your baby a chance to feed themselves. Jars and pouches and baby cereals are also available. Do check that your baby cereal doesn't contain milk. Most baby cereals marketed between 4 and 6 months contain some form of cow's milk or skim milk powder. Over 7 months, you'll find other options, but I would say that Ready Breck and Weetabix are perfectly adequate with a little bit of breast milk, a little bit of plant-based milk, a little bit of fruit, or made up with water. That is a really lovely, nutritious breakfast for your baby, and you don't have to go out of your way to pick a baby cereal marketed at babies. They're often a lot more expensive, and they're not necessary when you can use Ready Breck or Weetabix. A little reminder to you that when your baby starts weaning, they are going to experience wind, cramps, changes in their poos, and other gut symptoms. This is all normal. It takes a while for a baby's body to get used to digesting solid food. So don't worry if they get a little bit constipated, if they poo out pieces of whole food, or if they get a little bit of additional wind or tummy pains once they start solids. We know that some foods have a natural chemical called histamine in them, which can cause localized redness on the skin. This is called a contact reaction. So foods such as tomatoes, strawberries, kiwis, and aubergine can cause this type of a reaction. It's not an allergy, and your baby is safe to eat these foods, but you may like to use a little bit of barrier cream, for example, pseudocreme or Vaseline, on your baby's skin to stop their skin getting too red and irritated. As you start weaning, it's a good idea to keep a note of the foods that you've tried, so that if any other reactions occur, you can identify a pattern and let us know. And again, I'm reminding parents of babies with eczema, please ensure you optimize skincare using emollients and steroids and make sure the skin is clear before you introduce egg and nuts. Vitamin supplementation. If your baby is breastfed, then you and your baby both require vitamin D. If your baby is bottle fed and they're taking less than 500 ml of formula in 24 hours, that's around 60 ounces, then they require a vitamin D drop. This can be easily bought over the counter. Brands like Well Baby, Abidec, Baby D, and Nature's Aid are all available. Let's talk about milk and dairy substitutes now. If you're breastfeeding, you may already be using a plant-based milk. If you're starting weaning, you can use plant-based from when they turn 6 months of age, added into food, but not as a main milk drink until they're a year. Don't choose an organic variety. They don't have any added calcium in them. Here's some examples of soya milk. If your baby can tolerate soya, soya is probably the best choice in terms of nutrition. It's higher in calories and in protein, and all of these versions will be fortified with calcium, vitamin D, and sometimes iodine. Always check the label to make sure that the plant product that you choose is fortified with calcium, vitamin D, and iodine. Here's some oat alternatives. Many people enjoy the taste of oat-based alternatives, and they make a great choice for our babies. They are lower in protein, but as long as you're getting plenty of protein from your diet, that shouldn't be a problem. Oat products tend to be high in calories and well fortified. There's lots of supermarket own brands which are equally as good as the big brands, and sometimes they're also kinder on your purse. Coconut milks I wouldn't tend to use as a first choice because they're quite low in calories. But if your baby can't tolerate dairy or soya, or they have an issue with oats, coconut might be a good option. Choose a brand like Cocoa Growing Up or Cocoa Super because these are much higher in calories. And we don't want to be replacing your baby's usual milk intake with a low-calorie plant milk. We should always be trying to choose one that's got a decent calorie content. At least 40 calories per 100 ml is ideal. I wouldn't tend to recommend nut-based milks, but I know for some they are your taste preference. They're very low in calories. Some almond milks only have 13 calories per 100 ml, so they're not really a suitable alternative for our babies. But if your baby's growing well and these are your taste preference, it may be that they can be included as part of a balanced diet. But I would prefer you to choose a soya milk or an oat milk as a first option. There's loads of dessert alternatives available now as well. You will find so much available to you when you look at the free from section. For your babies, I would recommend choosing a plain, natural, or Greek-style yogurt. You can add in your own fruit as a flavouring. Some of the fruit-based yogurts, for example, here I've shown you some brands of Alpro, Coconut Collaborative, and there's also cocoa-based fruit flavour yogurts, but some of them are very high in sugar. So a natural or Greek-style yogurt is ideal. You'll also find things like Ella's Kitchen dairy-free pouches, Alpro custard, Oatly custard, Coconut Collaborative do a double cream, Oatly do this creme fraiche up here, and they also do different ice creams, which if you're dairy-free and breastfeeding, you may enjoy trying. Elmley do a lentil-based plant cream here. There's lots of options. If you enjoy cooking creamy dishes, hopefully you'll find one to suit your recipe, and hopefully your baby will enjoy a little bit of plant-based yogurt. Again, I would remind you to check that these are fortified with calcium. Some brands are better fortified than others, so it's always worth checking the label to see do they have in and around 120 milligrams of calcium per 100 grams. Dairy-free cheeses don't always get a great reputation, but for many of our babies, they enjoy them and they can make a contribution to their calcium intake. Look for a brand that's fortified with calcium. I recommend trying something like a Tesco, Asda, or Sainsbury's own brand, grated or block cheddar, or something like this Tesco Plant Chef cream cheese up at the top. It's fortified with calcium, iodine, and vitamin D. This big brand Fiolife is very popular, but it's really high in salt and it doesn't have any calcium. So where possible, a supermarket own brand is a great idea. You'll also be able to find dairy alternative spreads, things like Pure, Flora, and Vitalite. There are supermarket own brands available as well. You can spread these on toast or add into cooking. We're encouraging you to choose calcium fortified products to meet your baby's calcium requirement. Under a year of age, most babies will reach 525 milligrams from their milk intake, and as they start eating fortified yogurts, milks, and other products such as ready brak or breads and natural sources of calcium such as fish, leafy greens, beans, and lentils, they should have no trouble meeting their calcium requirements. Over a year of age, your baby should have no issue meeting their calcium from food. It's recommended that infant formula is stopped at around a year of age, and your baby should get all the nutrition that they need from the food that they are eating. For example, a tablespoon of ready brak gives you 200 milligrams of calcium. 100 ml of fortified milk gives you 120 milligrams of calcium. This means that in a breakfast of ready brak with fortified plant milk, you can easily get 320 milligrams of calcium, if not more. And that goes some way to meeting your requirement of 350 milligrams in a child of 1 to 3 years. So it just shows you your baby doesn't need a lot of milk over a year of age, and you can look to stop their formula. Breastfeeding mums, it's really hard to reach 1250 milligrams in a day. If you're struggling, make sure your GP has prescribed you a calcium supplement or that you've picked a suitable over-the-counter calcium supplement. We'll talk to you more about this in your one-to-one to make sure you're getting the calcium that you need. The question that all of you want to answer, will my baby grow out of this? The answer is probably yes. The question I can't answer is when. All I can say is that most babies will grow out of it somewhere within their second year of life. But for some babies, the allergy will persist, and it may persist for a number of years. That is still completely normal, but the older your baby gets, the more likely they are to grow out of it. In general, as I said, we will keep them dairy-free until they're at least 9 to 12 months of age, at which point we will start a process known as the milk ladder. If your child has any signs of a fast allergy, I will guide you on the specific ladder to use. But for most of our babies with a delayed milk allergy, we will use the 6-step ladder, climbing and seeing if a reaction occurs, pausing if a reaction does occur, and then retrying. This is what the ladder looks like. If you scan the QR code, you'll be able to download recipes, but I will talk you through this process in more detail along with the recipes at the time when you're ready to start. You'll see that the milk ladder starts with a small amount of well-baked milk in a biscuit, a muffin, or a pancake. We then build up to introducing cheese, followed by yogurt and other dairy products, and eventually, once all of this is tolerated, we can introduce some cow's milk into our baby's diet, either through food or, if your baby's over a year of age, this can be introduced as a drink. As I say, I'll guide you through this more when your baby is around 6 to 9, or when your baby is around 9 to 12 months, I should say, of age. This is the end of the presentation. If you have any questions, please make a note of them and ask us in your one-to-one assessment. We look forward to speaking to you over Zoom, discussing your little ones and answering any of your questions. Please make sure you check over this presentation again if there's anything you're not sure of. And check your booklet. There's a lot of information and helpful websites at the back of your booklet, which should help to answer some of the questions you may have. Thank you for your time listening to this presentation today.